And good morning.
Yeah, good morning.
How you doing, sugar?
I'm alive and I'm alert and I feel great.
And to no one's surprise, Rhodey is draws first blood once again. Brother, I'm so proud of you.
Guten Morgen.
Guten Morgen. Wie geht's? Ah, sehr gut. Wie geht's es Ihnen? Ja. So, Trish, Jamie, good morning. And David, I gotta say, brother, I've seen you in the chat the last several days in a row, and we appreciate your
thanks.
We appreciate your loyalty. Keep coming back. You keep coming back. We'll keep trying to be funny. Yeah,
Trying.
I make no promises, but we'll try.
Yeah, try.
So this morning, we're not. Cameron and I are not exactly of one mind on this particular topic.
Oh no, it's almost like we're individuals and we're capable of forming our own opinions.
Oh no, not free thoughts. Oh, hey, Ma's back. Good morning, Ma. We missed you. Love you, and welcome back from that trip. Ma and Granddad just took a trip with some friends and went up and. Well, long story short, we'll be having moose for dinner sometime soon. Yes, somebody won the lottery. Yes, it was a legal hunt. Yada. Mooses are delicious, by the way. And, yeah. Also, 3 days without a hangover. Congratulations. I don't know if you get a coin for that one, but...
I don't know either.
Oh, Dagen sind frei.
So, yeah, death panels?
Death panels. Okay. So let's just read the story first, and then we'll talk about all the ways that it can go. So we have this one from, and I'm sorry guys, I didn't take the time to archive the article. It comes to us through MSN, from the Washington Post. That it comes from WAPO already tells you a lot. Hospital system says it will deny transplants to the unvaccinated in almost all situations. This is going to be, and hey, they stock footage.
Well, it's more
stock
like
image.
photo. Yeah.
But yeah, it's still probably a product from Story Blocks or Adobe stock, something like that.
Anyhow,
Steve says that's some leftist inception shit right there. I'm actually going to push back on that a little bit, Steve, but only a tiny little bit, really. But we'll dig into it some.
Hey,
Colorado.
I was just going to ask, can I have the privilege of reading this morning?
Yeah, sure.
I waited for you to start reading.
There's a scroll wheel right there.
I waited. Oh, that's neat. I waited for you to start reading so I could interrupt you, just totally disrupt the flow of the show.
Fair enough.
Okay, a Colorado-based health system says...
Let me actually...
Yeah. A Colorado-based health system says it is denying organ transplants to patients not vaccinated against the coronavirus in almost all situations, citing studies that show these patients are much more likely to die if they get COVID-19. Just real quick, this is true, but when you're on the transplant list, you're a whole lot more likely to die of a whole bunch of shit. It's part of why you're on the transplant list, and after you get the transplant, you're also more likely to die of a whole bunch of shit. This is not special to COVID, but
now there may be space for an argument that post-transplant, you're more likely to have severe negative reactions to getting a vaccine after having had the transplant. So there is room for a reasonable argument in at least for getting the vaccine, not mandating, never mandating, but at least for getting the vaccine before you go through the transplant and increase your vulnerability to negative repercussions.
Can you move the thing back? I can't scroll.
Move what thing back?
That thing.
That thing.
Yes, that thing. Aha. UC Health's rules for transplants entered the spotlight Tuesday when Colorado State...
So wait, I could just take that power away from you anytime I like? That's fantabulous.
Well, I mean, it's your machine. The buttons are all over there. You could just kill the show on me mid-sentence. There'd be nothing I could do. UC Health's rules for transplants entered the spotlight Tuesday when Colorado State Rep. Tim Geithner said it denied a kidney transplant to a Colorado Springs woman because she was not vaccinated against the coronavirus. Calling the decision disgusting and discriminatory, Geithner shared a letter that said he said the patient received last week from UC Health's transplant center at the University of Colorado's Anschutz Medical Campus in the city of Aurora. The letter said that the woman would be
Compliance-frei Macht.
Yeah. The letter said that the woman would be inactivated on a kidney transplant waiting list and had 30 days to start a coronavirus vaccination. If she refused to be vaccinated, it said, she would be removed. Geithner did not identify the patient allegedly denied a transplant. Well, yeah, because, duh. Like,
right.
HIPAA.
HIPAA would not restrict him from
I guess if she shared the letter, yeah.
Well, even that, Geithner's not a healthcare professional or an insurance agent.
Yeah.
If he hasn't signed, I took HIPAA training and now I'm HIPAA certified to do HIPAA-covered stuff, then HIPAA doesn't apply to him.
Let me finish reading the next sentence, because the woman just self-identifies right here.
Right, but even before that, Geithner's got no HIPAA concerns.
Right. Geithner did not identify the patient allegedly denied a transplant, but Leilani Lutali, what a name. That sounds like a Star Wars character. Told 9 News that...
Or a DC heroine.
Yeah. That it was her and she was being coerced into making a decision that is one I'm not comfortable making right now in order to live. UC Health declined to discuss particular patients because of federal privacy laws, but the health system confirmed Tuesday that nearly all of its transplant recipients and organ donors must get vaccinated against the coronavirus, in addition to other vaccination health requirements. A spokesman, I misread
I don't care how they're plumbed. The word is spokesman. The word man is gender neutral in the context of describing the race of men.
Yeah, I know. I'm trying to cover up my word whisker. So, the spokesman, Dan Weaver, said that the other transplant centers in the United States have similar policies or are transitioning to them. The policy illustrates the growing costs of being unvaccinated and wades into deeply controversial territory, the use of immunization status to decide who gets limited medical care. The mere idea of prioritizing the vaccinated for rationed healthcare resources has drawn intense backlash as overwhelmingly unvaccinated COVID-19 patients push some hospitals to adopt crisis standards of care in which health systems can prioritize patients for scarce resources based largely on the likelihood of their survival. I don't think we need to go much more into the article. There's more here, and go back and read the whole thing, but I feel like we've gone through the thrust, and I want to stop right there.
Well, let's read just the next paragraph, because this is largely where our disagreement is going to center.
Oh, well, fair enough. Conditions on organ transplants are not new. Weaver noted that transplant centers around the country may require patients to get other vaccinations, stop smoking, avoid alcohol, or demonstrate that they will take crucial medications in an effort to ensure that people do well post-surgery and do not reject organs for which there is fierce competition. Okay, so just backing up to the previous paragraph, I'm going to be really clear about this. The previous paragraph is why guys like me oppose what the left refers to as universal health care. That phrase in and of itself is a lie. It's not universal because you eventually run out of health care.
Yep, no matter what.
Yeah, because, finite resources, okay, and that crisis standards of care in which they'll prioritize patients for scarce resources based largely on their likelihood of survival. Yeah, that's death panels with a really pretty coat of paint.
Right.
That's exactly what that is.
Okay, so Seaver touches on something that I really want to talk. He says, can they require a vaccine technology not approved by FDA? That's an interesting question. Several of the vaccines have now actually been approved by the FDA. And there's there is reason to be skeptical of the FDA approvals of some of these vaccines, and
millions and millions of reasons if you pay attention to the financials.
Yes. So I want to be very clear here. I am actually not super skeptical of the vaccine itself. Like I've said on the show before, I haven't messed with the vaccine yet because I've got a particular pre-existing condition that makes me very concerned about a particular side effect that has been associated with the vaccine. That's my particular situation, right? As far as any individual goes, I'm with Tim Pool on this one 100%. Talk to your doctor about whether or not the vaccine's right for. I'm not going to tell you to get the vaccine or not to get the vaccine. What I am going to say is that a mandate for a citizen or any part of the citizenry of the United States of America from the federal or state governments to take an affirmative action without a prerequisite condition is 100% unconstitutional and illegal. Good example, the argument between Obamacare and car insurance in the insurance world. Now, there was always a good argument to be made that it was unconstitutional for car insurance to be made mandatory. However, at least in the case of car insurance, it is only mandatory as a condition to driving a vehicle on government-owned roads, right? So, like, say you own a big-ass farm and you've got a pickup truck on the farm that you use just to work on the farm, and it never goes onto a government-owned road, then you cannot be required to pay ad valorem tax on that car or to carry insurance on that car if you don't want to, as long as it never goes on the public road. Now, fast forward to the Obamacare situation and the mandate, the Obamacare mandate, and that was getting us ready to hear that word, mandate. The arguments had to be made in the court that the penalty fee was a tax and not a penalty, except sometimes, depending on the context of the language in the particular part of the law, sometimes it was a penalty and not a tax. And they had to make that argument back and forth and thread that needle because the court said quite clearly, no, you do not have the authority to levy a tax without that tax originating in the House. And you do not have the authority to levy a penalty against people for inaction. Right?
Yeah, but John Roberts didn't give a shit about any of that.
John Roberts is a criminal.
Or rather, he did give a shit and help everybody thread the needle.
John Roberts is a hardcore leftist. I mean, it's that simple. John Roberts is an anti-constitutional, hardcore Marxist leftist.
Again, I'm not feeling the controversy. This
Good.
is not the hottest of hot takes. Our spice level is still really low here.
We need more meatballs. Now, as far as there being preconditions on the acquisition for an organ transplant,
I mean, duh.
That's not news.
Like the thing about we want you to quit smoking and quit drinking before we give you an organ transplant.
Now, here's where I get a little titchy on this one. I need more information to really dig into this. Like, if I had chicken pox as a kid and am therefore now immune to chicken pox, which I did have chicken pox as a kid and am therefore now immune to chicken pox.
But not shingles.
I never had a vaccine against chicken pox. Would I need to get a chicken pox vaccine before I could have a liver transplant like this? Right? So there's... And I'm hesitant to even discuss this now because we've already seen videos censored. Project Veritas had that release where employees, doctors with Pfizer, were on camera saying the natural immunity that is held by people who have already had and recovered from the disease is far superior to the artificial immunity generated by the vaccine. And to be clear, these guys were still saying the vaccines are effective, the vaccines work, but natural immunity is better than the vaccine. So David asks, points out, I couldn't find any info if patient had antibody testing. So that raises a great question. In and around these mandates, if I were to have antibody testing and be found to have antibodies from having had COVID and recovered from it, to be clear, I'm not sure that I had COVID and recovered from it.
I understand. I think they do too.
I had a bug right around the first time we started hearing about the COVID stuff, and it was pretty nasty, and it went away. Right? I don't know. I don't know if that was if that was the thing or if it was just a case of the regular flu. And maybe I'll get antibody testing at some point and find out. But I have had to have COVID tests for a few different things. I had surgery during the pandemic. I worked some film sets, and I had to get tested for those. And I tested negative, and so on and so forth. So something to understand about organ transplants. Steve, November 20, and I had it about the same time, around the same time. And that's when we were first talking about the COOF on this show and talking about what it was going to look like. And
boy, were we right.
I'd like to say that, but I kind of feel like I kind of feel like predicting Obama's failures and Trump's successes. It's like I knew it was going to be bad, but it's way worse than I thought it would be. Like Obama turned out way worse than I expected him to be. Well, the mandates, the authoritarianism, the madness, the absolute cult adherent psychopathy of the Branch Covidians has taken me entirely by surprise. Well, not entirely by surprise. I knew they were going to be bad, and I knew in what ways they would be bad. I never could have imagined the extent to which this moral panic and psychopathy would grip my countrymen.
See, but in this case, this is not a condition like you have to stop smoking. Okay? This is a vaccine that uses brand new technology that was rushed through, and God bless it. Like, we're not YouTube, we're not saying the vaccine is bad, okay? Let's be really clear. Nobody here is saying that. But this is different because, for example, you could be a whole lot more likely to die of the flu because of your suppressed immune system due to an organ transplant. So do you have to have the flu vaccine every year, which has a tendency to be about 60% effective, give or take. And those are big, broad numbers. But like when you go get the flu vaccine, all they're really doing
that's a good year.
Yeah, all they're really doing is inoculating you against the most likely strains of the flu. And given the fact that there are multiple strains of the COOF, to me, this is not the same thing at all. Okay, it's just not.
Yeah, and that's actually something interesting that we haven't talked about. Every year prior to the pandemic, prior to the COOF.
Oh, here comes the YouTube yeet.
For, I don't know, maybe 15, 20 years. 'Cause, okay, when I was in high school, I don't remember everybody making a big deal out of the flu vaccine.
Okay.
It was a thing that existed, but it wasn't. I wasn't being inundated constantly by propaganda marketing to go get a flu vaccine, and I wasn't seeing reporting on flu deaths annually. At that time either.
To be fair, I was paying attention to way different stuff in high school, though.
See, I wasn't. We didn't have as much. The internet wasn't as broad then, but it existed, and I had a pretty good machine in my room, and I spent a lot of time reading the news.
Yeah, when 256K was a great machine.
Oh God, dude, I remember thinking I'll never fill up a gigabyte hard drive, and now for my work, for my video work, I have to think in fractions of a terabyte. I no longer think in numbers of gigs. I think in fractions of terabytes. But
so Winston Smith in the comments says, "Good morning, Mark," and good morning, Winston. Mark Dice just released a video where he asked folks to sign a petition to have the unvaccinated evicted from their homes and/or apartments. No surprising, he had many people agree and sign.
wow, that is psychotic.
Well, but that's part of a point that I wanted to drive toward. Let's just assume for a moment that this is a reasonable restriction. Logically.
Oh, wait, let me back up real quick, because I was talking about the flu vaccine thing.
Right.
And annually we have on average between 60 and 100,000 deaths from flu. That's every year.
Right.
In theory. Now, that number is generated not by counting the number of people who died from flu, but by estimating the number of deaths that were probably related to flu.
Yeah, it's a best guess.
It's a best guess. It's a very sloppy best guess.
I don't know that it's sloppy. It's based on decades and
How
decades.
many people died of the flu last year?
I don't know that it's sloppy. It's based on decades and decades of research.
Yeah, but it's based on decades and decades of research of nothing more than that best guess.
No, they started with a raw number.
No, they didn't.
Yeah, they did.
Go read on this. I promise you they didn't start with a raw number.
Okay.
I spent some time on this rabbit hole recently. It has only ever been the best guess. It's...
Oh, you mean kind of like their best guess for COVID?
Or climate change.
Left turn, okay.
And the reason I mentioned that and then the flu vaccine is, for many years now, we've had a flu vaccine every year. We've had a flu vaccine every year. And it averages about a 60% effective rate and is often no more than 20 to 30% effective, right? But when we have a flu vaccine that comes out and is only 20% effective, do we suddenly need a booster? Do we get additional iterations that target the other strain that was missed by the best guess? Right? The booster thing I find unnerving.
Well, hepatitis vaccine comes with boosters. That's done in stages.
That's done in stages. That's done in scheduled stages, because hepatitis is a particularly virulent virus. And that's the way that vaccine works. And I don't want to get too far down this rabbit hole either, because I'm afraid this is actually the rabbit hole that got us heated before. But the COVID vaccine is a new technology. It's the mRNA technology. So it is a very different type of medication than the hepatitis vaccine.
And it's the most fortified technology of all time. I'm sorry.
I could put so many needles in this arm. No longer a joke about homeless people in San Francisco. Or is it?
Could be both.
Oh. You know, the homeless population of San Francisco was probably the best initial sample group that could have been used for testing on this particular vaccine, because they just wouldn't have noticed another track mark.
Yeah. So, flu vaccine, right? Okay. We don't have boosters, but we go back every year. And that's because for some reason it's okay to say out loud that the flu vaccine is not perfect.
Right.
There's another vaccine that we may or may not be discussing this morning. Not allowed to suggest that that sucker's not perfect, no matter what the evidence says.
Right.
So,
we had that article about the hospital in Wales, where 1/3 of COVID patients in this Welsh hospital are unvaccinated, and Crowder said it best. Wow, that's an interesting way to write that. 66% of the COVID patients in this particular hospital got it after they were vaccinated. And again, the flu vaccine isn't 100%, and there's, but it's troubling that we went from the vaccine will wipe out the virus to the vaccine will make it suck less.
Yeah, we went from not getting shot to you're going to wear a bulletproof vest.
Right.
Which, is what it is. So here's my big issue.
Steve points out flu vax is the two most likely for the year, not all strains. Exactly, and that's why it has varying levels of success from year to year, is because they pick two strains that are, at best guess,
right,
most likely.
Well,
and I say at best guess, not statistically guaranteed, because that what might otherwise be a statistical guarantee misses often.
Well, and let's not get too hung up on the fact that COVID is also a virus that will mutate, that's got various strains that you're supposed to be afraid of. Like, be afraid of the Delta strain, okay? But here's the thing. If we assume for a moment that this is reasonable, okay? Here's my larger problem. It is the slippery slope thing, okay?
Yes.
It is the next step toward some type of authoritarian mark of the beast type thing. Because as soon as you accept, okay, under the small set of conditions, you can have life-saving care if you take this vaccine that you're not comfortable with taking. If you don't take this experimental technology, we're denying you the kidney transplant and you can just die of renal failure. Okay. It kind of reminds me of, I don't know, let's pick an example, say, the income tax. When it was first passed, it's only going to affect those super rich people over there. It's never going to affect your life, and it's only going to be a tiny percentage of their income anyway.
2%.
That's right. Only a tiny. And they're rich. They can afford it. And then...
Never mind that less than 7 years later, the top marginal income tax rate was 96%.
Steve says there's a 99.7% chance you won't shit your pants.
No, there's not.
But we require you to wear this diaper at all times, just in case. Okay, that's funny. That's funny.
I saw 30% of a special operations unit shit their pants in one mission one time. And it was it wasn't even a special operations unit, really. It was a special op, but it was the entirety of the 101st Hard Rock Company. A little more than a third of them just had to ride back on towels.
So, but I want to take this, then I want to tie it back to Winston Smith's comment from a few minutes ago, where people go around and they sign the petition, and you get evicted from your apartment or your home unless you get the vaccine. I mean, this is your death panels and your authoritarianism just in this nice little fascist blend right here. Because it starts reasonable. It always starts reasonable. It starts small. It starts 2% on those rich people over there. It's never going to affect you. Okay? But then what's next? How long before we actually get to the point to where you're not allowed to have a job, for example, if you can't prove that you're vaccinated?
Right.
Just off the jump, okay?
And we're already seeing stuff like we mentioned yesterday, things like the whatever Hollywood Awards thing, the Met Gala, so on and so forth, where everybody there is vaccinated. But there's a clear delineation between the beautiful people and the serfs. The serfs are wearing masks.
Right. And
they're being depersoned. They're having their identities removed. And that's got nothing at all to do with the safety of people based on the ability of people to spread vis-a-vis vaccination. If that were the case, then everyone would be masked. But the beautiful people, they're not
relative
masked.
To the size of your steeple.
And I'm right. And I say the beautiful people, tongue in cheek, because let's not forget that Horse-Faced Cortez is one of these people in her Tax the Rich dress.
I don't know.
funded by tax evasion.
You know, if you cut her off about here and just go the rest of the way down.
Okay, she's got a decent figure for a horse.
Yes, decent figure for a horse. I don't think that this is hyperbolic. I don't think that.
But like any other Marxist horse, I don't want to ride the bitch.
Fair, okay. Okay, slippery slope, hyperbole.
I especially don't want to ride that bitch down a slippery slope. That sounds like an ass over tea kettle and stuck in the wrong dark spot in a real quickness. Plus, it's a slippery slope, so you're not getting down there dry.
Your mother's watching.
I love you, Mom.
Okay. Anyhow, slippery slope and all that. A year ago, okay, let's roll the clocks back. Well, first of all, let's start by rolling the clocks back 2 years ago. No, I'm gonna power through this. All right, get fucked. I'm gonna power through this. All right. Roll the clocks back 2 years ago, and this woman gets her organ transplant. The thought of you have to take experimental medicine or you're not allowed to have the organ transplant. In fact, Donald Trump was the opposite. Remember, he was the guy that was like, you're allowed to do the experimental medicine.
Absolutely do the experimental treatment if you want it, and no one can deny it to you.
Okay.
If it's possible life-saving technology.
But then we roll the
clocks.
And
I'm 100% with that.
Yeah, but then we roll the clocks back 1 year ago, and remember when we were all alarmist for saying, whoa, I don't know that this mask mandate's a good idea. It could lead to vaccine mandates and vaccine passports. And everybody said we were crazy. But we weren't crazy.
So I had a surgery last year, and I'm going to describe it in
little detail.
As little detail as I can to make the point about its significance. It was scheduled for several months earlier than I had the surgery and had to be rescheduled to several months later. I had a...
You had a surgery.
I had a thing... I had an infected location that needed to be excised. And because of the surgery having been delayed, the infection got significantly worse. And when it was all said and done, the chunk of infected material, the piece of me, because you can't just get the infected material, you got to get all the shit around it. They cut a chunk out of me the size of a Coca-Cola can. And my recovery time was, I was laid up in bed for a couple of months. I ran out of Netflix, guys. I ran slap out.
This was before Squid Game came out.
Yeah, it was. Although there were some other Korean horror dramas that I did watch, and they were fantastic. Yeah, check out some Korean horror dramas.
Train to Busan?
Yes, definitely Train to Busan.
Anyhow,
anyway,
your surgery.
But that delay was unnecessary. It was political. Because we were looking at a situation where we were being told that hospitals were overcrowded because of the emergency situation. I know we're long now. Hospitals were overcrowded because of the emergency situation at the same time that we were watching emergency hospital facilities. Not so much here in Georgia, but here in Georgia is not where we had the majority, the really big numbers. But you're seeing stuff like the Mercy and the Hope, I think, were the two naval medical vessels deployed at huge cost to the taxpayer and then left unused by politicians to make a political play. I got frustrated and I lost my train on that one.
Lost the plot.
I lost the plot on that one.
It happens.
But oh God, yeah. Oh yeah.
David says, bet those dancing nurses on TikTok pissed you off, Chris.
100%.
Okay. What really bothers me about this, in particular with this, okay, it's like going out in public and seeing people still wearing masks. Like, I went to a certain pizza establishment the other day, and there was only one person in there wearing a mask. And I just wanted to tell him, sir, it's okay. You can put the cross down. We need the wood. All right? It's all right. I promise. Okay? Anyhow.
You could put the cross down. We need the wood. That one's for Cameron.
Winning! There's always going to be something attached to this particular vaccine. Okay, there's always going to be stigma and suspicion, and the very same people pushing the absolute dog shit out of it right now are the reason why there's suspicion. Again, roll the clocks back a year. You remember Kamala saying, I won't take Donald Trump. Oh! Wow, it's almost like you knew I was going to bring this up, and you had the article ready to go.
Kamala Harris says she wouldn't trust a vaccine Trump recommended.
Damn, and it's almost a year to the day. That's rather impressive. Today is October 7th, 2021. So 364 days ago, this is what your vice president said. Okay.
And here's the quote. She said, if the public health professionals, if Dr. Fauci, if the doctors tell us that we should take it, I'll be the first in line to take it. Absolutely. But if Donald Trump tells us that we should take it, I'm not taking it. Okay, Kamala, what if they all say you should take it? Because let's be real clear here. This is Donald Trump's vaccine. This vaccine only exists because Donald Trump cut red tape to make it possible for steps to be skipped to develop the vaccine. Right? Because Donald Trump said, no, get the regulators the hell out of the way. We need this vaccine. And the accusation was, they talk about it in this article. This article is from The Wrap through MSN. This is a lefty article. They even go so far as to make accusations. Where was it? Asked at Wednesday's vice presidential debate whether she would take a vaccine approved by Trump administration before or after the election. Harris said she'd be the first in line to take the vaccine. Public health professionals. Harris's one-liner didn't happen in a vacuum. They come after the Trump administration has, in recent weeks, tried to speed up the process of vaccine production to come out before the election. For instance, this week when it tried to overrule FDA guidelines for the safe development of a vaccine in a transparent attempt to have a vaccine before the election. However, the FDA ultimately prevailed, and the safer guidelines will prevent a vaccine from being rushed out. A vaccine, which I might add, came out, was made available, was approved less than 2 months after this article, which, if anybody's keeping track, is a week after the election.
The most fortified and awesome election of all time.
So,
look, it bothers me because what's next? We've already seen society shift to the whole mask thing and all that, and now it's the vaccine thing, and it is like, and what, papers please? Somebody pointed out earlier in the thread that Justin Trudeau has now basically told everybody that works for the Canadian government, get vaccinated or get fucked.
Yeah, same thing with, was it the Australian? I don't think it was the PM, but one of the Australian politicians was making the point. And we didn't even get to Fauci yet.
Meanwhile,
we're way over. But
meanwhile, Norway just said, "Yeah, you know what? It's probably not going away. Fuck it, we'll just live with it."
Yeah, and that's going to end up being. I'm not even saying do away with the vaccines.
They're just going to live with it. I
suspect the vaccine is going to be just a part of life going forward, and
kind of like because the coronavirus is just going to be part of life.
Well, and
the word is endemic.
We're hearing all this crap about it's a pandemic of the unvaccinated. Guys, I mean, here's your stats on the vaccination. Right. More than half of the U.S. is vaccinated. Right, and even when you look at the map down here, Even in those evil, crazy, backward, racist, scary blue or red states. I mean blue states, but
I know. No such thing as a blue state.
But red states.
Yeah, sure.
But even in those crazy red states like Florida, more than half, a third of Floridians, right, have had a vaccination. So, and hardly anybody is above 70. Yeah, hardly anybody's above 75%. You got Connecticut, Mass, Rhode Island, Maine. No, Maine's under 75. You know, not even California's broken 3/4. Most of the country, like even on the state by state breakdown, is over 50%. No, all of the country, even on the state by state breakdown, is over 50%. The country at large is, over 2/3.
We are way long. Our chat is abandoning us.
So,
yeah, it's a thing that happens.
Yep. So it's not like people aren't getting the poke. They are. And I think I think we're just gonna abruptly cut it off there because we are so way long that the chat's given up. Love you guys. Anything to close on?
This is authoritarian bullshit. Steve said it best. This is some leftist inception shit right here.
Yep. Y'all, we're in trouble. Be safe out there. We'll see you tomorrow.